Thank you so much for joining the Dr. Whisperer podcast show. I am your host, Sharon Feckety, and you are here to listen to others talk about the business of medicine. Don't forget to subscribe, share it with somebody else that is in the business of medicine so we can all learn together. Thank you for being here and enjoy the show. Hi, everybody. Welcome to the show. I'm very happy to have an audiologist here today, and her name is Dr. Amy Sarow. And I'm very happy that you're here because I think that what you do specifically isn't commonly understood. And I speak from being able to work with audiologists in the past, and I think that you provide a great service. So first and foremost, welcome to the show.
Thanks so much. I'm excited to be here.
Thank you. So I have asked the doctor today, because this is a show about the business of medicine, that we dive right into having some discussions surrounding the business of medicine. And Dr. Sarow is out there, everybody, okay? She's on TikTok. She's on Forbes Health Advisory Board and a contributor, all social media forums. So I wanted to have that discussion selfishly for all of the physicians that I've worked with in the past that maybe don't think that this is their route, that they're going to stay in one lane. So why don't we start there?
Yeah, certainly. So I also wouldn't have expected, a year ago, if you had told me, I'd be doing these kinds of things, I wouldn't have necessarily expected that. Mm-hmm. I'm sort of an introverted personality, but I do enjoy writing. And I got into making my own blog starting this past summer. And I started kind of experimenting with different topics, wondering what might be interesting for people or what might resonate with people. And as an audiologist, I'm finding that that is my expertise. And actually, there's quite an interest in that topic. I know as we were just discussing during the pandemic, certainly there was a greater awareness for people as they were wearing masks. Anybody who was sort of struggling with their hearing, they certainly became aware of it when they were presented with a person speaking to them with a mask on, taking those visual cues away. And then there would be other questions about, I have this sound in my ears. What is that? And, people just wanting to know the answer. Also the ear, there's a hearing portion and there's a balance portion of it. And so I've been sort of, talking about and writing about these topics. And as I got started in that, I had some opportunities come up. So when you're writing a blog, you want to reach out and try to collaborate, get links, meet people. And so that's how I happened to start working with and collaborating with some people at Forbes Health. And that turned into an invitation to join the Forbes Health Advisory Board, which I was so honored and excited to be a part of. And that's just it's been wonderful, really. And I recently, it's been growing. I started TikTok just a couple months ago because I had some requests, hey, could you just talk a little bit about what does it mean if you have hearing loss, or what does it mean? What is this ringing in my ear? So I started making these short videos, and people have been appreciative and enjoying that sort of content as well. So there's a big need for health related content that is, useful, informative, and digestible for the consumer.
So definitely. Congratulations on all of that, first and foremost. Tell me what that has done then for your business. Are you practicing solo right now?
So I have sort of a unique situation. I work with the veteran population, and that's sort of my day job. Yeah. And then I also recently started, and that this also came out of the writing work and things that I've been doing. I work as audiology lead or lead audiologist for a company called Soundly, and we help to educate consumers on their hearing health. And so I do some writing. We create videos with related content as well. So I do that. And then I'm also doing some freelance writing in addition to the blog writing, the other content creation. So I'm doing a little bit of everything, but I'm a little bit more on the consumer side, but I do also work with actual patients during the week.
I love it. Yes. And going on your website, which is available for everybody to just click on in the show notes, I see how, I didn't know that there was a new Barbie that was wearing hearing aids. So can you tell me a little bit about that? There's all these wonderful resources that I was unaware of myself, and I thought it was a great space to learn more, because I don't think there is enough education out there, like you mentioned, and
Yeah.
content is needed.
Yeah. So with the Barbie, so I've also, as I've been on my blogging journey, I'm learning how to do things like keyword research. So I'm looking for topics that might resonate, that people might be interested in, or that they're searching for. And that was one that I came across, and I thought, well, this is great actually, because it shows some diversity, some inclusion, with people who have hearing loss. And also with Soundly, that's something that we're wanting to do too. We'd love to be able to change the landscape, so that people are more comfortable and there's less stigma associated with wearing hearing aids, or, having hearing loss in general. So that's kind of an exciting way that we're seeing, in a child's toy, we're seeing that they're including a hearing aid. So that's just a great piece to highlight. And I did put that on my blog.
I love it. So tell us a little bit about Soundly, because this is the first time I'm hearing about this company.
So Soundly was started by a gentleman who himself has hearing loss and wanted to share some of what he experienced in his journey. So that's Blake Cadwell, the co-founder and CEO of Soundly. And I've been working with Soundly, with this company, to help answer some questions like, what does it mean if I have conductive hearing loss versus, high frequency sensory neural hearing loss? What is a good hearing aid option for me, or what are my options? Should I think about a cochlear implant? What do I do about like cleaning my ears? How do I do that? So just all of these kinds of questions. So I assist with content with that. And then Soundly itself is to help consumers know more about what hearing aids are out there, and what's the difference between over-the-counter versus prescription level care, and what are all the pieces that I want to know about before I make my choice, to find out what's best for me.
And did Soundly reach out to you after you were doing your blog?
That it sort of happened organically. So I use LinkedIn kind of as a tool and a resource.
Yeah.
And so I would try to, connect with people where I would see in my space, the hearing space and audiology space, it's small. So in the US, there are about 12,000 audiologists. And not everybody is out there writing or, on social media and that sort of thing. So I was looking to make connections with people who were in my space, where I thought maybe we could collaborate, or maybe there's something we could work on together, or maybe it's just a good connection to have. So we sort of got in touch over LinkedIn, and we ended up having a Zoom meeting, and then it just kind of built from there. Soundly was looking for someone, an audiologist, who'd be able to help assist from sort of that perspective versus the consumer side, which they know better as being founded by a consumer. So I was really excited when we started that partnership, and it's grown from there. So starting this month, I'm officially lead audiologist for them.
Go girl. That's awesome. Last episode of the Dr. Whisperer, we had on a PR expert, and I really loved, because some of my clients, they've been listening to me for so long, I think they're just sick of listening to me, kind of like with parenting, like you give advice to your child and then they hear it from a perfect stranger and like, oh my God, what a great idea. So I do this purposeful, like I really love to have these conversations to show them that putting out content and being an expert in a space, because it is audiology. My goodness, I don't hear a lot of audiologists on social media. I don't see them a lot. I don't know if I know of an audiology podcast. Maybe there is. If there isn't, maybe that's something else, right? That can be done. But I think that there's opportunity in providing, being an expert and seeing how, all of these wonderful opportunities can come up. And I love the fact that you didn't know that this was going to happen and this is all organic, but you at least had the wherewithal to know, you know what, I'm going to just go for it and try to collaborate, because collaboration is one of the fastest ways to grow your business. And I think you froze. And so we'll just pause, because this is like modern technology.
Okay.
So continue. Sorry to interrupt there. We had a little technology issue, which, happens in 2023 even.
Yeah, so it's so true. As I said, and as you mentioned, I hadn't planned for all of this to happen. It just kind of has happened organically. And I think if you have in your intention that you want to do something good and you want to connect with other people, there's so many possibilities out there, really. Especially in the health related field, people are looking for information, they're looking for help, for guidance. And if you can be the one to provide that to them, support them, that's just so welcomed. And yeah, I'm really excited and I'm thankful for everything that's happening. So I would certainly encourage other people to do that as well.
Yeah, that's great. Great advice. So now I want to know what got you interested in this field. Why did you choose audiology?
Yeah. So I started out, actually, my undergrad degree was in German. And
Wow.
I taught English in Germany for a few years. And then I came back to the US. And I taught English at a university briefly. And then I decided, I think I'd like to make a change. I'd like to go back to school. And I was considering speech pathology because it is in some ways related to teaching. I didn't know about audiology though. And I was taking some post-bachelor coursework, and I had been a musician, obviously interested in communication because of that tie to language. And it just sparked something in me. I saw one of those videos where they activate a cochlear implant, and it's just, it changes your life. And just, I was amazed that there's the possibility to do that in a profession. And so I decided to, rather than speech pathology, I thought, okay, I'm doing audiology.
Yeah.
And so, I went to the University of Iowa, which has a great program for audiology. And then I did my 4th year residency program at Mayo Clinic in Florida, which is a great experience. And then I ended up, now I'm back in Michigan, where I'm originally from. But yeah, I'm very excited to be in this field.
Yeah, I love that. I've worked with a lot of speech pathologists, and I know how much that has shifted. Even now, there's so much telespeech therapy. There's so many incredible ways to learn so much more about this particular industry. And I would be remiss if I did not mention what I hear so much of, probably because I work a lot in the mental health space, about tinnitus. And you pronounce it differently than I do. And I don't know if there is a correct pronunciation at this point, but maybe you could just share a little bit about tinnitus.
Yeah, so I do say it tinnitus, but both are considered correct. Some people say tinnitus, some people say tinnitus. I say, potato, potato. So, yeah. So what we know about it, first, we don't currently have a cure for it, but I always tell people that doesn't mean, if you have it, that doesn't mean you should feel like, oh, I'm stuck with this. There are management strategies for it. A lot of it has to do with lifestyle modification, managing stress, staying well hydrated, getting good sleep, good nutrition, any triggers that like caffeine or red wine, these kinds of things that might trigger it for people or exacerbate it, those can be managed. I should back up first and say that tinnitus on its own is a symptom. It is not an illness or a disease, but it could be a feature of another illness. So if you have that along with other symptoms, so in my space, that would, we'd talk about the ear. So if you've had changes in your hearing, or dizziness, imbalance, or if you're feeling fatigue, any other health changes you're noticing at the same time, that should always be evaluated by a physician, see a doctor, talk about that, because it can be a feature of, autoimmune or other things there. But we also know that a lot of people in the United States experience it, about 50 million Americans. And a good percentage of those have some degree of underlying hearing loss. So we know that hearing loss and tinnitus are often related. And so another management strategy is to look at treating the hearing loss, which sometimes has the positive side effect of lessening the tinnitus perception.
Okay, and great. I think, I can't help but want to help maybe somebody that is not a physician that's listening or interested in watching or listening to this podcast. that could learn something from you today, because I certainly learned a lot working with an audiologist in the past. Let's talk about AirPods. I really hate the fact that I was like, I love my AirPods, and now I have, and I haven't stopped using them, but I do have them. I have an app, and I also have them set where I can't have it louder, and I'd like to. I used to listen to everything so loud, and there's no need for that. It was almost like I got stuck listening to it that loud, and now I'm much more used to a softer way of listening to my podcasts and my books and all of that jazz. So let's have that discussion. Let's talk about AirPods and what damage that could actually cause to your ears.
Yeah, so that is a great point to bring up. So you do want to think about your daily sound dose. I like to compare it to, sun exposure or sodium intake. There's a certain level where, this much is okay, but if you go beyond this threshold, that's going to cause damage. It's not going to be good for your health. So we don't see the effects of noise damage in the same way that we would see like a sunburn, right? That's really obvious that you've had too much sun exposure, you've caused some damage. But you can have remnants of that noise where you've exceeded that healthy dose by having ringing in your ears or having things feel muffled. Over time, it could creep in. Or as you mentioned, if you're used to listening at a certain level, that's kind of what you're used to hearing. So, over time, what we're comfortable with, it needs to change to be healthy in some cases. So I know in my grad school program, we did this where we would bring in students in the student community, and we would tell them, okay, so bring your cell phone in with the headphones or, the AirPods that you use, put them in your ears, turn it up to a level you like to listen to it. And then we would put it in our mannequin, where we could measure how loud that was in his ear. Mm-hmm. A lot of times it was like 100 decibels. It was loud. And you can damage your hearing within 7 to 8 minutes at that level. You can already create damage. And most of us are listening to more than a couple songs, probably, because that's like 2 songs. So yes, so that's a great point. And there's one simple tip that I tell people. This is really easy and you can save your ears. Just go in your phone settings, like on an iPhone, you go into the settings, go into accessibility, and you can lower the maximum volume. So even if it's your favorite song and you turn it all the way up, you're never going to go to a dangerous level. If you are going to turn it up or you're going to be in a loud place, you want to at least limit the time. At the very least, do that, because even that can help. Yeah,
as much as I get frustrated, I mean, now I can just press my AirPod and say, turn the volume up. And she goes, you're at the highest level, because I have that set up. And I think that it's, as much as it's been an adjustment, I know that I am taking care of my health, and my physical health will ultimately always affect my mental health. So, and speaking of that, there's also, for me, I didn't know that this was really a thing. I still don't know if there's a name for it, but I'm never good in really loud spaces. I have almost like a physical reaction to it. I'm always looking to sit in the corner away from all the noise. And I don't really know what that is, but is there a term for that?
Well, so some degree of discomfort with loud sounds can happen as we get older, and it varies depending on personality. It can also, for people who have hearing loss, that is something where, so we have this range where, let's say you have normal hearing, so you can hear really soft sounds, and then you can hear, up to really loud sounds. There's a point at which it becomes uncomfortable. When you have hearing loss, the softest sounds you can hear changes. So we sort of, instead of this much, let's say there's this much of a range you can hear. So there's a shorter distance between what you can barely hear and what becomes intolerable or uncomfortable. That over time, what's uncomfortable can shift down a little bit. And now I'm talking with hearing loss. It can also happen to people as we get older, even if you don't have hearing loss. For people where it's really extreme, let's say they're getting physical pain because, they hear a sound, that does go more in the direction of hyperacusis, where, I saw one on 2020, there was a person living in, I think, New York City, where they would go outside. If they left their house, they would have to wear, these special earplugs because they just couldn't tolerate even normal sounds. It was too loud. It would be uncomfortable for them. So there is actually, a condition that does have that. But some of us experience that, where we find that uncomfortable.
Yeah. So, all right. The last question for the patient. This is some free advice here, everybody. When do you go see an ENT versus an audiologist? Like, what is the difference? I know.
Yeah, that's a great question. Yeah, I think that's a great question because a lot of people don't understand what an audiologist is or know the difference between those two professions. So in a lot of situations, an audiologist and an ENT, they work closely together. They work, let's say, side by side, but what they do is different. So an audiologist looks at a person's hearing. They talk about basically the areas of hearing, dizziness, and tinnitus. Those are kind of the ear-related dizziness, I should say. So we'll do diagnostic testing to evaluate, a person's inner ear balance function. We do tests to check your hearing. We talk about treatment options and rehabilitation options for hearing loss, ear-related dizziness, and tinnitus. Now, if we're talking about a medical condition, let's say you have an ear infection, you have ear pain, you have, sinus problems, something like that. That's all going to be your ENT that you'll talk to. So that person can prescribe medications, can look at medical etiologies. An audiologist looks at the hearing side of things. When we're wanting to get a good answer for a patient about, okay, you have this hearing loss, what might be causing it, or what are your treatment options? That's kind of where both sides can work together. So for example, for a cochlear implant, an audiologist is going to look at, are you an audiologic candidate for this? A physician is going to evaluate you. Are you surgically healthy for this surgery? And then they'll talk about, whether that's appropriate for you and give you advice and that sort of thing. Yeah,
that's great. So, all right, before we wrap up today, we want everybody to turn down volume. We really do need to protect our ears. And, I worked in pediatrics for a long time, and I never knew until I worked with them that it wasn't a good idea to stick your Q-tip all the way in your ear, and you could really do some serious damage. So there's a lot to learn. Our ears are very important. And I think having captions on screens all the time and in social media, providing an opportunity for people that don't have the advantage of hearing. I think a lot of the younger generation now just turns on captions, even though they can hear perfectly fine. It's kind of our new way of absorbing material from the internet and also from television. And I think that it's really great that you made a decision to just do what comes naturally and organically and put it out there online, and all of these great opportunities came to you. So, Amy, I appreciate you being here today, and stay warm in Michigan.
Thank you so much. I was so happy to be here, and yeah, thanks for having me.
Don't forget to check out her blog. It really has a lot of great information. Click on the links on the show links and follow her on TikTok. It's good stuff. Join 2023, everybody. That's where everybody is. Thanks, Amy.